Hello doctors, have a beautiful day. Today we are looking at the muscles of the larynx. So we're looking at some of the actions, that is opening of the inlet of larynx. So this is done by the thyroepiglottis. Next function is closing of inlet of larynx. So this is done by the epiglottis as well as the interarytenoids. Next, looking at the abductor of vocal cords. So the abductor of vocal cords is facilitated by the posterior cricoarytenoid. Now moving ahead, looking at the adductor of the vocal cords. So this includes the lateral cricoarytenoids and the tensor of vocal cords. This is by the cricothyroid. Next, looking at the relaxers of the vocal cord. This is by the thyroarytenoid. The modulator of larynx. This is by the vocalis. Now looking at some pointers. So if you see, all muscles are adductors, whereas one muscle is abductor, and this is the PCA. Next, all muscles are supplied by the recurrent laryngeal nerve, whereas the cricothyroid, this is supplied by the superior laryngeal nerve. Next, there is something known as the safety muscle of the larynx. Safety muscle of larynx. So this is nothing but the posterior cricoarytenoid. Next, looking at the safety muscle of the tongue. So safety muscle of the tongue is the genioglossus. Then looking at the muscle for whispering. So this includes the lateral cricoarytenoids. Then another interesting fact about the vocalis. The vocalis is the modulator of the larynx. So why is it the larynx modulator? It has the anterior part. Anterior part, it tenses the vocal cord. Next is the posterior part. The posterior part, it relaxes the vocal cord.